The Women Advocates Research and Documentation Center has advised the federal and the state governments to subsidize and include tranexamic acid in standard delivery kits across the public health facilities. The human rights advocates also enjoined the government to ensure its consistent availability at all levels of care. The WARDC founding director, Dr. Abiola Akiyode-Afolabi, made the call on Monday at the closing ceremony of Project Transform, a 12-month community-based intervention aimed at reducing maternal mortality in Nigeria through improved awareness, access, and advocacy for tranexamic acid. Dr. Akiyode-Afolabi stated that the Project Transform was designed to address postpartum hemorrhage, one of the leading causes of maternal death in Nigeria, which accounts for nearly 25% of maternal mortality nationwide. She called on the health authorities to fully integrate tranexamic acid into maternal health protocols, emergency obstetric guidelines, and training curricula for healthcare workers, stressing that timely access to the drug could save thousands of lives. Akiyode-Afolabi warned that delayed response to obstetric emergencies, weak health systems, and limited access to essential medicines continues to claim the lives of many Nigerian women during the childbirth. The WARDC boss called on the policymakers to build on the gains of the project by prioritizing sustainable funding, policy reforms, and supply chain improvements to ensure that life-saving maternal health interventions are accessible to all women in Nigeria.
Be accessible in a manner, that women will be able to afford it, or because we know that it is an issue that affects women's lives. There's actually nothing stopping government from making provision for this to be free for all women as a way of reducing maternal mortality. So we also call on health authorities and regulators to integrate CXA fully into maternal health protocols, emergency obstetric guidelines, and training curricula for healthcare workers. There is an urgent need to strengthen supply chains so that cost, stock out, and access barriers do not continue to cost women their lives. We know that beyond tranexamic acid, there is also another medication. Is it menstrual? What? That is being used. Mr. Postal, no, oh yeah, that is also being used. So our call is that those medications that are used to stop bleeding, they should make them free, so that when a woman comes in and run into an emergency of that nature, they would be able to get respite. Development partners and donors should also support. Beyond speaking about maternal mortality and creating awareness, we are calling for scale-up of successful community engagement models. You can only ask what you know. If you don't have the information, you will not be able to ask.
We are doing it because we have passion to help women, and there is no woman that should die when deliver a baby. So with this, a lot of women at the community, they are aware that they have to go to primary health center, and we have already told the TBAs, the registered TBA, that when they see any unregistered TBA, they should report them to us. When they report them to us, we take it up from there. And those people that are registered, they should do referral immediately when they see any woman that is bleeding after delivery.
Because before they can even access where vehicle can take them out, the woman may not be able to work. If it is in the night, to get vehicles across the water, across the river, is a challenge. So they even say that many people are dying after childbirth. So we want government to exempt tricycle, especially when they are carrying pregnant women. Either they are going for the clinic or they are going for the delivery. They should allow the tricycle to ply the highway.